Greetings, this is Dr. Sandra Cabot. This video on parasites looks at natural treatments. Can they help to eradicate parasites? The liver is an attractive destination for many parasites. The liver is an immunotolerant organ and thus is an easy place for parasites to hide from the immune system. Parasites have a large range in size. Injury to the person infected by parasites can vary from minimal to lethal. I've done 4 videos on parasites as it's a big subject. Let's look at natural anti-parasitic herbs and foods. Conventional medical drugs can get rid of parasites more quickly than most alternative treatments. However, alternative treatments are helpful after conventional medications have been used, or if the medications are not fully effective. Natural treatments are also helpful if you have recurrent drug-resistant infections with parasites, such as entamoeba, Giardia, Helicobacter pylori, and worms. It is important that your doctor must find out what kind of organism is causing your problems before you start any treatments. Also, let your own doctor know if you intend to use natural anti-parasitic treatments. Natural anti-parasitic treatments have been used for centuries to reduce intestinal and liver parasites, and are especially useful if your problem keeps recurring. Anti-parasitic herbs include anise, barberry, berberine, black walnut, clove oil, gold thread, golden seal, wormwood, turmeric, oregano, and thyme. Anti-parasitic foods include pumpkin seeds, carrots, raw coconut flesh and coconut oil, raw and cooked garlic, apple cider vinegar, pomegranates, and beets. In one study, researchers found that a mixture of honey and papaya seeds cleared the stools of parasites in 23 out of 30 subjects. It is important to drink a lot of water to help flush parasites out of your system. Let's look at some suggested supplements. Intestinal Paraclean capsules. These contain a selection of herbs known to reduce parasites. These include wormwood, black walnut green hull, cloves, garlic, butternut root bark, and buckthorn bark. All these are combined in one capsule. It needs to be taken in the middle of meals. Another supplement can help. This is called Bactoclear and comes in the form of enteric coated capsules. Each Bactoclear capsule contains philodendron to provide berberine and essential oils, oregano, thyme, and clove bud. Bactoclear is also best taken in the middle of meals. A competent immune system is very important when trying to overcome recurrent parasitic infections. A healthy immune system is essential to reduce your risk of developing a disease from any parasite. Any microorganism that has the potential to cause disease that is living inside your body is a parasite. You are the host, and they are using your resources. For example, the bacteria called Helicobacter pylori, which lives in the stomach and steals your nutrients, or the yeast Candida that can colonize the gut and steal your nutrients. Bacteria and fungi that live in your sinuses, such as Streptococcus, Staphylococcus, Haemophilus and Moraxellus, could be considered parasites as they live in your mucus using your nutrients. Viruses are clever parasites as they live inside your cells and transform your cells into virus-producing factories. Some viruses known as retroviruses, such as the human immunodeficiency virus, insert their genomes into the DNA inside the nucleus of the cells they infect. When we talk about good immunity, we need to consider the health of the immune system in the whole body, known as general or systemic immunity, and the health of the local immunity, which is the mucous membranes in your body cavities. Mucous membranes are found in the mouth, throat, sinuses, respiratory tract, urinary tract, and intestines. Most infections enter the body through the mucous membranes. To help your immune system to resist acute and chronic or repeated infections, there are some excellent supplements. These are useful as most people do not have a perfect diet. Infections often cause nutrient depletion, and our soils have become depleted of critical immune minerals. The supplements I recommend are vitamin C, 1000 milligrams daily to boost systemic and local immunity, vitamin A to boost mucosal immunity. Vitamin A can be found in vitamin A capsules or in cod liver oil capsules. Selenamune, 1 capsule daily, is excellent to boost systemic immunity. The supplement NAC, or N-acetylcysteine, can boost systemic and mucosal immunity. NAC should be taken in between meals with a whole glass of water. The diagnosis of parasites often gets missed. Due to climate change, migration, and globalization, the incidence of all types of infections and parasitic diseases is increasing. The correct diagnosis of a parasitic infection is often delayed because doctors are unfamiliar with the clinical presentations of the different parasites, which is often non-specific. There may be very few or no symptoms, which makes accurate diagnosis even harder. Successful early recognition of parasitic diseases requires a high level of awareness by doctors. It is important to do diagnostic testing for parasites in patients who have lived or travelled in areas endemic for parasites, or for patients who are unwell with no correct diagnosis being made. Another problem is that the use of immunosuppressive drugs for chronic inflammatory diseases has become far more widespread, and these drugs make a parasitic infection, and indeed most infections, more dangerous. This is because the patient's immune system is unable to fight the infection, and the parasite becomes much more invasive and destructive. Let's look at some tests to detect infection with parasites. We have already discussed some of the tests in our other videos on parasites, but to summarise them again is worthwhile. A feces test is the same as a stool test and is the most important test. Stool microscopy is essential. Eggs or worm parts may be detected. It is wise to test 3 separate bowel actions as one sample may miss the parasite. PCR test of feces to detect genetic parts of the parasite. Imaging. Ultrasound of the abdomen followed by CAT scan, PET scan or MRI scan to check for liver lesions such as cysts and granulomas or lung and brain lesions. In chronic liver fluke infections, a motile parasite might be detected in the gallbladder or main bile ducts with an ultrasound scan. Histopathology in specimens obtained by liver and or bone marrow biopsy. Blood or serologic testing. Serum antibody ELISA and liver function and a full blood count to check for elevated levels of the blood cells called eosinophils. Some, but not all, parasitic infections can be detected by testing your blood. Blood tests look for a specific parasite infection. There is no blood test that will look for all parasitic infections. A feces test is the most important test, and it is wise to test at least 3 different bowel actions. Follow-up testing is required to promptly detect reinfection or reactivation of the parasite. To prevent infection with parasites, wash your hands frequently with warm to hot soapy water, and especially before handling food or before eating, after touching soil and handling animals. This prevents most infections. Teach children the importance of washing hands to prevent infection. Wear gloves when handling raw meat. Wash the meat with warm to hot water before cooking. Deworm your pet dog or cat regularly and dispose of their poo in a bin as soon as possible. Boil tank or tap water before drinking. Only drink bottled or boiled water in high-risk areas, such as places without modern toilets or sewerage systems. Water can have tapeworm eggs if it is contaminated with dog feces. Cook meat and seafood thoroughly. Overdone is safer. Wash and peel or cook all raw vegetables and fruits before eating, particularly those that have been grown in soil that has been fertilized with manure. In summary, almost all parasites count as food and waterborne diseases. Long-term control requires an integrated approach, combining early diagnosis, individual treatment, good public health measures, food chain safety, and animal health interventions for diseases with animal reservoirs. Some parasites can cause severe disease and death. This is because they can cause malignancies, liver disease, bile duct obstruction, and gallbladder attacks, and eventually liver failure. Although parasites cause a significant global burden of disease, treatment can be very effective. Awareness, prevention, and early recognition and treatment are the keys to success. Hope you've enjoyed this video, and if you have, click like and subscribe. And if you have any questions, send us an email from liverdoctor.com, and thanks for listening.